This is Dr. Govardhan Reddy, the Chief Urologist at Aster CMI. I'm basically interested in the Uro Oncology and renal transplant surgeries in Aster CMI. So when we talk about kidney cancers, this is very common in occurrence. One. Second thing is that it can occur at any age, so there is no age specificity. Previously, we used to see these cancers in the elderly age group, but of late, nowadays we see them in a very younger age group also. Most of the patients come and ask, why did I get a cancer? That is a very difficult question to answer because nowadays it is becoming difficult to really pinpoint as to why these cancers happen in these younger age group. That could be because of multiple reasons, because we presently live in a world where everything is poisonous. What we eat is poisonous, what we drink is poisonous, what we inhale is poisonous. So previously we used to say that there were some risk factors which could really predispose these patients to have a cancer, but now it's not so. It can happen to anybody. And another important thing one should be very aware of this is that most of the time these kidney cancers are not symptomatic. Most of them just get to know when they do scanning for some other thing. So we call this as an incidental tumor. So it happens because they went for a doctor or they went for a health checkup, and during that process they did an ultrasound, and then they came to us saying that we have found a mass in the kidney, and then from there we diagnose them as a kidney cancer. So very difficult to diagnose. Most of the time it is innocuous, no symptoms present, so it is very tricky in nature. And some people do get symptoms. If you ask me what are the symptoms, they can come with kidney cancer. They can have a pain in the abdomen, they can have a lump. If it is very big lump, they can feel by themselves, or they can have blood in the urine. So these are the few symptoms which they present to us whenever there is a kidney cancer. Now the next question is, what happens? What happens when I am diagnosed with a kidney cancer? So that will be most of the time the questions. One way of seeing this is that if you see the recent way of finding the kidney cancers, where people are getting it diagnosed because they do a scanning. So what I told previously as an incidental carcinoma. So these cancers are good in nature because they are detected very early in their presentation. So they are most of the time what we call in general terms as stage 1 disease. So in kidney cancer there is stage 1 to 4. So most of the tumors who come to us with an incidental finding or in the stage of stage 1, and that has very good prognosis. So if they come with symptoms, say as I said, when they have pain or bleeding, so usually these patients are coming at a little higher stage. Means they may be in second stage, third stage or fourth stage also. Because ultimately the treatment differs as to what stage you present to us. Now the question again will come most commonly asked is, what do you think about kidney cancer? Second thing, what is my prognosis? Means how I am going to do with this cancer. So am I going to be alive? So there are many, once we diagnose a cancer, it is a very scary situation for patient and their families. So it is a very difficult situation, which as doctors we do understand that. But through this, I would like to just give an information stating that once we diagnose a kidney cancer in a very early stage, there is a good treatment. The most probably it will be a surgical treatment. Again, when you come to surgery, of late we are doing what is called a partial resection of the kidneys. We are not going to remove the total kidney unless the kidney cancer is very big or it is occupying a very dangerous region in the kidney. Otherwise, we try to get only a part of the kidney out and try to preserve that kidney. And when it comes to the prognosis of this patient, how they do, most of them do well. So most means we are talking about over 90% of the people, if we do a partial nephrectomy, they do very well. So they life expectancy, that is cancer-free survival rate at around 5 years is around 90%, and if they cross say 10 years, they are almost cured, so they may not have cancer again. So it is with the increased technology, with the availability of robots in most of the centers, and even the technical excellence by all the clinicians or surgeons who are dealing with this type of tumors. So the results are very satisfactory, very encouraging, very good, very good for the patient also. So that is one thing. And another thing, the question is what happens if it is late? So there is a presentation at stage 3, stage 4. Then we definitely will evaluate the total condition. We'll try to restage it, see whether we can offer you a surgery. Because of all the treatments which are available for kidney cancer, surgery is the best treatment. So basically kidney cancers are known to be very radio resistant. That means they may not respond to the radiation, they may not respond to chemotherapy. Of late we have what's called immunotherapy. Again, if you talk about immunotherapy, the ratio, that is the percentage of response to immunotherapy, is very less, and that's why if we find a patient who is in a surgical candidate where we think we can remove total tumor, then that is the patient who can do very well in these situations. So as to summarize, the kidney cancers are common. It is of late occurring in a very early age group also, very younger age group, and early diagnosis has a good prognosis. And definitely with this, through this thing, we would like to send in information saying that a regular health checkup, especially once we cross the age of 40, so a regular health checkup would definitely have a beneficial effect on anybody who's doing a health checkup. Thank you.